I'm Sarah Bracey, and this is my final project for my nursing informatics class. This project, I decided to talk about enhancing patient-centered care through virtual simulation. Welcome to this presentation on enhancing patient-centered care through virtual simulation. As healthcare evolves, the need for effective technology enhanced education becomes increasingly important. Our goal is to introduce an education plan that immerses staff in realistic clinical scenarios using virtual simulation, allowing them to practice and refine essential skills to delivering patient-centered care. Patient-centered care, so initial assessment. Patient-centered care focuses on treating patients as active partners in their care, respecting their preferences, needs, values, and evidence shows that this approach leads to improved health outcomes such as better chronic disease management, reduced readmissions, and increased satisfaction according to AHRQ 2020. Patients who feel heard and involved are more likely to adhere to treatment plans. However, despite this, it its proven benefits, delivering consistent patient-centered care remains a challenge without ongoing structured staff education. Okay. So for the learning objectives, this training initiative includes 3 SMART learning objectives to guide learning. First, within the first 30 minutes of the session, staff should be able to clearly define the foundational principles of patient-centered care, such as respect, collaboration, and holistic treatment. Second, through interactive virtual scenarios, participants will apply these principles by practicing empathetic communication and culturally sensitive responses. Lastly, by the conclusion of the training, each participant will identify at least 3 concrete benefits to patient-centered care, like reduced anxiety, improved satisfaction, or better adherence. These objectives ensure learning is targeted, measurable, and aligned with both patient needs and institutional goals. Virtual simulation is more than just engaging training method. It is a dynamic learning experience that replicates complex clinical encounters. Learners are immersed in real-time decision-based scenarios that promote critical thinking and reflective practice. Unlike traditional lectures or online modules, simulations encourage learners to make decisions, observe outcomes, and receive immediate feedback. Okay, so justification for this tool choice. Virtual simulation is uniquely suited to teaching patient-centered care due to its realism, interactivity, and interactivity. Learners engage with avatars that respond emotionally and physically based on user input, which helps build empathy and emotional intelligence. Okay, so for resources available, our institution already possesses valuable infrastructure to support this initiative. The Learning Management System, LMS, will host simulation modules and track participation and assessment data. Our simulation lab is equipped with high-fidelity mannequins, computers, and audiovisual tools. We also have access to platforms like Shadow Health and SimX, which specialize in interactive virtual scenarios tailored to nursing education. To make this initiative a success, several additional resources are required. First, licenses for simulation software must be purchased to access virtual patient modules. Facilitators will need designated time for training and content review, and technical support staff will be critical for troubleshooting and ensuring smooth operation. The timeline for this, the implementation will cover 6 weeks. Week 1 and 2 will focus on finalizing content and selecting simulation scenarios and training facilities. In week 3, we will run a pilot with a small group to gather feedback, and based on this input, we'll make improvements if needed. During the 6th week, we'll collect evaluation and data, and we'll make necessary improvements. Recruitment plan. We'll have digital and in-person strategies, like emails and flyers and things like that. Contingency plan to ensure successful implementation and communication will be ongoing and multifaceted. Staff will be informed through emails and digital bulletin boards and huddles and direct manager communication and evaluation. Program success will be measured through a combination of pre and post assessment, staff satisfaction surveys, and patient experience metrics. And in conclusion, this virtual simulation-based education plan offers a modern evidence-based approach to strengthening patient-centered care. Thank you so much for listening to my presentation, and here's my references. Have a great day. Thank you.